First, we're going to look at common issues with the spine. Spinal issues can be caused by postural issues like wear and tear over time, genetics, or a traumatic event like a car crash. Review the structure of the spine and how many curves does the spine have and what are they? Well, there are 4 curves. There's the cervical, thoracic, lumbar, and sacral. So what is the structure of the spine? The spine is a series of stacked bony vertebrae interspersed with fibrocartilaginous discs. Each disc has a nucleus pulposus, like a soft gel-like center, surrounded by a fibrous annulus fibrosus. Which part of the spine takes the most weight? The lumbar spine is the most weight-bearing and has the largest vertebrae. What key structure does the spine protect? The spinal cord lays in a canal that is formed behind the discs when they're stacked. Now, let's talk about spinal issues. And are these issues usually the result of disc issues? The disc itself is deteriorating and causing pain, and bony issues, like the facet joints aren't aligning properly, or the discs are not stacking properly. The most common spinal issues are disc issues. When there's a deterioration in the invertebral disc, the discs become less shock absorbent and effective. Also, if there is pressure on the one side of the disc, over time the disc can bulge or become misshapen, or even rupture where the nucleus pulpus has ruptured through the annulus fibrosus. The spinal cord is directly behind the disc, so a disc that bulges posteriorly backwards may compress the actual spinal cord. Ouch. We're going to look a little bit here on the pelvic tilt and the lumbar spine. And the objective in the activity that we're going to do together during this video is to viscerally experience the relationship of posterior to spinal health. So I'm going to ask you to sit tall on your sitting bones. So if you're sitting on a chair, come to the edge of something and sit tall so you've straightened your back and you have a pelvic tilt, which is forward, or an anterior tilt. Can you feel the deepening of the lumbar curve here? Tilt the pelvis backwards now and just slouch. That's a posterior tilt. Can you feel the lessening and the rounding of the lumbar curve in the spine? Imagine the disc like a jelly donut. Depending on which way you're tilting, you're putting pressure on one side of the disc or another. And when doing this, you're squishing one side of the donut force of the jelly center to push to the opposite side. So which tilt puts more pressure on the front of the disc? The answer to that is the posterior tilt puts more pressure on the front of the disc. So that's the posterior is when we kind of are slouched over. The body imitates what is happening in the spine. When the front body shortens, the front of the spine shortens and the back of the vertebrae opens. When the back body contracts, the back of the spine shortens and the front of the vertebrae open. So what's our daily postural habit like when we're sitting? The answer to this is a posterior tilt, slouched. The moral of the story: over time, habitual posterior tilting will compress the front of the discs and push jelly of the disc towards the back, which can cause a bulge or a herniation. Generally, but not always, this can cause a posterior bulge or herniation. When we look at a diagnosed versus an undiagnosed pain, often students have not been properly diagnosed. They just have back pain. Students who have been diagnosed with back pain may have a clear idea of the direction of their herniation which it could be in any direction. It's simply common for it to be posterior. Either way, your goal is to help students move in a pain-free range of motion and give them common sense modifications to support their practice. In your Google Classroom, you will find a little bit of an activity and an assignment that you are going to complete and then upload and answer those questions into the Google Classroom for marking. So, addressing a disc injury. In a posterior herniation, the disc is bulging backwards. Poses like forward folds, which squish the front of the disc and push the jelly backwards, will make it worse. If you have a forward folds like seated forward fold, pyramid pose, and even standing forward bend, encourage students to take a straight spine instead. Back bends will tend to relieve the pressure. General common sense modifications. Avoid forward folds or any position that exacerbates pain. Keep the spine neutral rather than in flexion, and back bends are great. I may not pronounce this one correctly, but I'm going to give it a whirl. Spondylolisthesis. Spondylolisthesis is a condition where a vertebrae becomes displaced anterior to the one below it. In essence, the upper vertebrae slides forward. As you can see from the picture, back bending would exacerbate this condition. Depending on the severity, students will need to keep the spine only in neutral and in flexion, and this tends to be diagnosed. What is a common sense advice or modification for spondylolisthesis? Avoid back bends and keep the spine neutral. If you have a back bend in class, suggest a different pose. And the fun one, the pain in the butt, the sciatica. Some spinal pain is caused by nerve impingement. For instance, nerves getting compressed by the vertebrae. This is caused by the impingement of sciatic nerve by vertebrae as it exits the lumbar spine. It can result in the tingling, in pain, in numbness, and weakness in the leg. Sciatica-like symptoms can also be caused by the impingement of the piriformis muscle, which equals the piriformis syndrome. Sciatica is very individual, and the different movements will exacerbate in different conditions. Moral of the story, this condition affects people differently. Empower your students to move in a way that does not aggravate this.